All right. So it's my first time. Oh, by the way, hi, I'm Rob Pack. I am, let's see, professor in public health, and for a long time I was associate dean in the College of Public Health, and now I'm executive vice provost at the institution, and with Angela Hageman, I'm co-director of the Addiction Science Center. Been working on recovery research for the past 4 or 5 years or so, and the principal investigator of a NIDA-funded study called the Studies to Advance Recovery Science. And with that, I'm also a member of a consortium on addiction recovery science, which is we call it the COARS, COARS, and there's a large group of folks from around the country, maybe 7 different teams that are organized into multiple different study groups, one of which is focused on peer recovery support specialists, and we operate that one out of ETSU with our partners from Virginia Tech, and also with a partner from Connecticut. So we've been working on recovery research for quite some time, and I've got to say, this is a really rewarding field. It's wide open for study. There's so much that can be done here. I'm excited to be speaking with you guys today. Forgive me for the, you know, just all the foibles and other problems that come with trying to record one of these lectures and how it goes. But the Studies to Advance Recovery Science grant actually has within it a specific aim to start a recovery research graduate certificate, which is what we did. And thankfully, Dr. Brooks and Dr. Mathis took this on to lead the first course. And I am delighted to be presenting today on the topic of measurement, models, really models and measurement. I'm going to go in that order and organize my thoughts today around sort of a general overview with an example using a framework and why these things are useful. And then I'll stop this video and then I'll post it, and then go through a couple more videos, and then give you a bunch of resources. And likely the way that's going to go is just kind of showing you, what different things are, how to think about them, or think about them however you want, but how I think about them, and then we'll kind of go from there. But I did a little PowerPoint here for the first one, so I'm going to share my screen. And I'm thinking what's going to happen here is I'm going to be able to post this video to YouTube on a private link, and then I'll be able to give that to Dr. Brooks. I think that's what's going to happen. I will see. I'm going to go ahead and do this first one and then try to post it, and then we'll see where that goes. I'm hopeful that you will be able to see. I don't know which one's showing. Swap displays. Which one's showing? I'm showing my screen. Let's see. Oh, that's it. Okay, it's the wrong one. Let me swap displays. There we go. That one should be the right one. All right, we'll see how this goes. I'll post it. We'll see what's up thereafter. Okay, I'll just go ahead and tell you the information now. I know some of you that are in the class, others I don't. And the idea behind these recordings is that we'll be able to use them over and over. So that's why I took a little bit of time to introduce myself, and then we'll just go ahead and dive into it. So way back in the day, we used to talk about the whole problem of prescription opioid addiction with this graphic, and it's basically a life. It's called a life course um, graphic, and the idea for it actually came from Dean Wyckoff, Randy Wyckoff, Dean of Public Health. And he and I were talking about how complicated this whole problem was, and he said, "Well, it helped me back in the day when I was trying to talk about how complicated all the decision making was about HIV and AIDS, to really draw it out and think about it from a life course perspective." And what that did, it sort of clicked, turned on a light bulb, and then we got together in a retreat one time. We started drawing on a whiteboard and came up with this general idea of the continuum from non-use to fatal overdose. That's kind of that's sort of the continuum: non-use of opioids, and then one logical outcome from a long time use is potential fatal overdose. And so we used this kind of concept, and then thought about, okay, well, let's lay some stuff over the top of it. Here's physical dependence, and then here's sort of the addiction space over here. The real danger zone is in this space right here. And then, these are the levels of prevention: primary, secondary, tertiary prevention. And and what we thought was, there's all these evidence-based programs that are effective at different times along this continuum. And so let's just go ahead and articulate what those are, at least some of them. And then we'll kind of, just describe them and briefly, and got a few words in this little blue boxes, and sort of where they land on this continuum. And so if you think about primary prevention, dissemination, implementation of primary prevention programs is really over here, focused on the non-use end of the continuum, right? As is health professions training and continuing education. So for example, if you're trying to teach medical students or medical residents or nurses and others about the risks of overprescribing, right? That would be over here. And then over here in the prescription drug monitoring programs and diversion control space, it sort of lands over here in secondary prevention. What you're doing is you're trying to prevent the drugs that are existing out in the community from being misused. And so that's where monitoring programs come into place, and take back programs and things of that nature. Diversion control. And then screening, brief intervention, referral, treatment is sort of a little bit further down the continuum, is where you're really trying to identify early signs of physical dependence that could tip over into the addiction space. And then on down the list, you got abstinence-based and medication-assisted treatment, both of which are very legit. I mean, there's a lot of evidence for 12-step programs, for example. There's a lot of evidence for medication-assisted treatment. It really depends on the individual. We'll talk about that in some detail in a few minutes. And then over here, related to neonatal opioid withdrawal syndrome or neonatal abstinence syndrome, the NOWS, neonatal opioid withdrawal syndrome, is a more modern term, and that is sort of on down the continuum, right? These are moms that are dependent or maybe addicted to opioids, and how you kind of handle that. There's some evidence-based strategies for handling that, but they're way on down the continuum. Same is true for treatment here. And then there's overdose reversal with naloxone, and evidence-based drug course, et cetera. So that's kind of the continuum that we used. We talked a lot about the messaging of this continuum, and how return on investment should be considered with way diminishing returns on investment. So the further you go down this list, the more costly these things are. And that is true. I mean, if you can prevent substance use disorder, you're doing way better than if you have to, pay for example, treatment or some of the more costly aspects of treatment, especially things like wound care or maybe some disease, infectious disease that results from injection drug use. And so it's just a really good idea to try to prevent things in terms of ROI, return on investment. All right. So I say all that to say, okay, that's a framework, that's a model, right? Turns out that it's way more complicated than that. We started really digging into this and thinking through, like, what would it actually mean to do something comprehensive in this space? And so we turned it up a notch and decided to kind of lay on different evidence-based programs, these EBPs right here. This is what would it take to really think through how to implement a whole wide variety of these evidence-based strategies in a community. What would you need in terms of the kind of infrastructure, supports, models, things of that nature? What would you need to really set up in order to make that work well? And this is one crack at it. And in fact, it's not even close to as complicated as the whole thing really actually is. Because if you think about it, these are really three-dimensional or four-dimensional matters here, because you really also have all of the institutions that drive these things. And then they also have to live in a policy context, et cetera. So there's a lot more going on to this whole recovery, addiction and recovery treatment and prevention treatment and other recovery space. And lay all this out just to kind of ground all this in sort of the utility of frameworks and models. Because even though this isn't fully sufficient, it is a good crack at attending to the complexity of this situation. It's a thoughtful, informed attempt to really kind of lay out a lot of different details and how they relate to one another in a two-dimensional space. And I'll just take you through this for just a second. This has to do with primary prevention infrastructure, and this is the communities care sort of level here. And this is really a primary prevention program that's focused on helping communities protect their asset, protect their health and safety from really significant harms. And then it's got multiple different phases. And then there's an acute care working group that kind of handles stuff that's more further down the line related to treatment and overdose prevention. Then you got the context of the agencies. You got the inner and the outer context, but the inner context for the agencies, and then what it would take to get people to adopt and then adapt evidence-based strategies, for which there's a ton of research. There's a ton of research on school-based prevention and workplace-based prevention and drug disposal and naltrexone access and buprenorphine access, et cetera, et cetera, et cetera. All these are evidence-based approaches, or EBPs. And then how do you facilitate bringing those to bear in the context in which they're needed? Well, there's some bridging factors that you have to attend to. And then you also have to think about the context, the outer context for the structural interventions. And so that's really what this is. It's kind of working you through some of the complexity here. That could help guide a scale level, community-wide intervention that's focused on primary prevention and also on treatment. So again, thinking about the concepts here, from primary prevention to sort of secondary prevention, tertiary prevention, but also, being mindful that that's not even all of it, because there's a whole other thing that we didn't even consider at the time. And this is around 2018, 2019, right as we were beginning to get into the recovery research space. We didn't even talk about all of the recovery support services that would be helpful for folks that are sort of moving back out of the space over into the non-use space, right? And that is why I wanted to show you this, because it's as complex as this is, it doesn't even acknowledge all of this, which is all of the stuff that's going on in the community with respect to recovery. And so I'm laying all this out just kind of show you that there's a lot of stuff that exists at the interpersonal and individual level, but then there's stuff at the community level and stuff at the institutional level and the stuff at the policy level, and you can measure all this. You can actually, in fact, I'll take you through some measurement tools a little bit later on, but you can actually look at things like self-esteem and recovery, self-efficacy, and identity reformation, and willingness to engage, and things of that nature. You can measure how much there is, how much support there is in a community that's focused on recovery. You can see whether there are recovery community organizations, and you can see whether or not there are peer services, and so on and so forth. So all this stuff can be measured, and how you measure it really does matter. So I'm going to take you through a couple of things that we've done related to recovery ecosystem and measuring the larger picture, and then we'll go into some specific details about how to use that stuff, and then kind of put all that in the context of models and frameworks, and then we'll get into some nitty-gritty related to useful tools for measurement. So a lot of what I'm talking about now is application, right? So it's less recovery research, although you can do research on adoption of evidence-based practices, but it's less research about sort of the nitty-gritty than it is about sort of the uptake. And then ultimately what we'd be thinking about is, how do you measure, like, a number of overdoses that are prevented against the baseline, for example. Well, that's not really recovery, is it? So it's helpful to kind of keep all that in mind. Think carefully about what you're trying to measure, and think carefully about what the purpose of the study is. One of the really, I think, common mistakes that people make when they're embarking on a research program is they don't spend the time on the front end thinking about the things that they're trying to do and really operationalize the definitions and what their different kinds of variables are. So this is the recovery ecosystem. It's a framework. This is just a general kind of almost like a Bronfenbrenner or a social ecological sort of map of what's happening. And this is actually out of a paper that goes into some more detail about recovery framework that we'll talk about in a minute. So after we kind of embarked on our recovery research agenda, we got connected up with the Center for Rural Health Research and their partnership with NORC, the National Opinion Research Council. And we began thinking through like how we could examine the recovery ecosystem in the context of like all what's going on in every community with respect to recovery. And so we did this thing called the Recovery Ecosystem Index map, and I will show you. I have the wrong slide here. I just realized that. I'm going to share a different screen with you for a minute, and I'll show you this other tool for just a second. So stop sharing that one, and go over to this other screen. And share this one with you because this is the right one. So, so we developed this recovery ecosystem index map. And so think about what we're doing here. We're trying to figure out what exists in a community and how do you measure it? And then can you get county level indicators for all those different things? And the answer to that question is no, you can't. So we had to come up with proxy type measures. I'll go ahead and show you what all the measures are for this thing. This is the Recovery Ecosystem Index. And we'll just click on a random county. Here's one in Tennessee, it's Anderson County. Oh, well, how about that? I grew up in Anderson County. So I'll show you what this is. So we decided to think about the different component parts of the Recovery Ecosystem Index, and those are things like SUD treatment resources, and then whether or not there's a continuum of SUD support in the community, and whether or not there's infrastructure and other social determinants of health kind of indicators for a given community. And we also wanted to examine counties from the perspective of the state level policies. And so each county, they got a score for this, and every county in the US did, really it reflects their state level score. So within Tennessee, all of these will be the same number, but we looked at each one of these indicators and they gave them a score, and then added them up to create the state policy score. Okay, so these are the main components, but then each one of these subcomponents feeds in to this larger component. So in this case, the SUD treatment score for Anderson County isn't great. It's in the middle of the road. They don't have that many substance use treatment facilities per 10,000. They don't have that many buprenorphine providers per 10,000. Not that many. The average distance to the nearest MAT clinic, for example, is pretty far. And mental health providers per 100K is actually not that many, et cetera, et cetera. And so we took each one of these as proxy indicators for something that we were really trying to examine, which is the true continuum of SUD supports in a community. All right, so this is an example of almost like a surveillance tool, something that could be thought of as a tool for kind of getting the lay of the land and comparison between how the county is doing against how it's doing relative to the state, and then how it's doing relative to the nation. So that's measurement for sure. And it's measurement about recovery. And it's the first attempt that I know of to do a national level tool like this. And we're real proud of it. Don't get me wrong, but it's not what all is happening in a given community. Okay. To do that, you got to go to a sort of a different level. And so we had this in hand. We had the early draft of it because we were part of the team working on it. And we were thinking through, like, if opioid abatement dollars are going to be coming out, how do we decide how we're going to spend those in a given community, right? So there's a big national settlement. Tennessee, all in, I think they'll wind up with about $1 billion of opioid settlement resources over 17 years or 18 years. And so what's the most strategic use of those resources against, against this whole big continuum that we were talking about earlier, right? How can we maximize the impact of these resources so that they have the most effect for the community? And so we, started looking around at different models, and it made sense to, let me go down to this thing. It made sense to really begin thinking a little more strategically about what all these recovery assets look like in the community. And so we found this framework. This is the Recovery Ready Communities Framework, to be very helpful. And so what we discovered was doing a kind of a classic, community-wide prevention focused program, or doing a classic treatment focused program wasn't going to be sufficient. We had to figure out how to make something that was going to support people that are seeking to be in recovery, and then something that would be useful to them as they went through their recovery journey. And so this was a very thoughtful approach, we believed. And so we um, dug in with this thing and then decided, let's try to figure out where all of our assets are in the community. And so the first recovery ecosystem index map, what we did was we didn't have county level indicators for all of those component parts that are on this framework map. Okay, we didn't have, for example, a central location that said, okay, for every county in the U.S., here's where all the recovery community centers are. And here's where all the prevention organizations are. And here's where all the harm reduction organizations are, especially harm reduction, because sometimes those things fly under the radar, right? We didn't have all the recovery residencies mapped. There's a better tool for that now, but we didn't at the time. We didn't have all the recovery community organizations and so on. And so we had to think about proxies for those indicators at that time. And so we said, well, what if we just sat down and wrote out where all of those assets were based on our knowledge? And that's what we did. So this literally started on the back of a napkin. I remember doing it like the first little bit of the first couple of passes of this were done in pen on napkins and at a table where we were sharing a meal. And it's like, hey, where are all the different things that we know about? And can we put them in all those different boxes relative to all of our assets in this region so that we can make an informed decision about the kind of investments that we need to make here in Northeast Tennessee. And so we did this recovery ecosystem asset map. And this is pulled together by one of our talented doc students, Marissa Kluk, who is also a staff member of the Addiction Science Center and in the role of recovery ecosystem alignment director. And so we just started putting into a spreadsheet. She started putting into a spreadsheet all these different assets, and then making all of them live, like writing in descriptions of what they were and where they were and just geolocating everything. And so that was super helpful because then it allowed us to take action related to forming objectives for recovery assets. And so what we did is we convened an advisory council, Regional Recovery Ecosystem Advisory Council. We did that in partnership with Frontier Health, the director of Frontier Health, and myself and Angela Hageman from the Addiction Science Center, and just started convening the other folks that needed to be in the room relative to the kind of investments that should be made in the region. So we engaged Ballad Health, for example, our region's largest healthcare system, and we talked to the recovery housing folks, invited them in, and invited in some political leaders, including those involved in the criminal legal system, like attorney generals, district attorney general, judges, mayors, and so on, and began to educate them on all of this stuff related to the recovery ecosystem, and then showed them what our asset map looked like. And then that allowed us to make some informed decisions about what some gaps were. So that's what we've done at this point. We took the asset map and we worked with the council and came up with priority objectives in prevention and education, treatment and recovery, connections to care. This is a key one. We'll talk about that in some detail a little bit later on. And housing and transportation. And this one is, my goodness, so important, housing and transportation, because relative to the social determinants of health, I mean, if you don't have good housing, good supportive housing, and you don't have transportation to your job, you're going to have a difficult time, I believe, on your recovery journey. And so a more difficult time. It's not impossible, I believe, but you're going to have a more difficult time. Um, so that's like practical, like that's how we use frameworks in the field. Okay. And this is a popular, I say it's popular, we talk about it all the time. I don't know how much is being used outside of this region. I do know that Robert Ashford, who's the lead author on this paper, is a thought leader. And when I read this paper, it really opened my eyes to what we were missing relative to our own thinking. And it helped me with it helped ground me in a different type of understanding for the work of our center. So um, I think I'm going to stop there. Actually, you know what? I'm going to go backwards for a second because I remember I placed a slide in here on this right here. This is very, very important. So probably should mention this up front. But I take the perspective that this is the best definition of recovery that I've read, and it helps me because when we get down to operationalizing things, this is a big one. It's got a lot of different words in it, and it can be very difficult to actually pinpoint what recovery means based on this huge definition. But what I will say is recovery is not binary. It's not a this or that. It's not a complete abstinence. It's not a complete falling off the wagon thing, right? It's a much more nuanced, individualized, intentional, dynamic, and relational process involving sustained efforts to improve one's wellness. And so when you think about like the difficulty of conceptualizing this, and first of all, it's individualized, and it's intentional, it's dynamic, and relational. Well, in some ways, you would have to have questions about each one of those things. To what extent is your recovery and you perceive it to be individualized, and then how about intentional, and how dynamic is it, and so on and so forth. Can be quite difficult to measure something like that, and yet we talk about it all the time, right? And so we'll go through some specific measures that get around, sort of dance around the concept of what is recovery. And to do that, I think we're gonna have to dig into some sort of larger questions about like how nuanced can things be and still be measurable, right? And then what does that mean? What are the implications thereafter for research studies? Because research studies, you got to be able to measure stuff. So I'm going to go ahead and stop this part now. That's the general overview, and then we'll kind of begin digging into some specific list of different tools, and we'll go from there.